Okay, welcome everybody. Thank you so much for joining us today. Really excited to be hosting this month's Lunch and Learn, talking about 10 years of the Pathways of Care longitudinal study of children in out-of-home care and recent findings on supporting successful restoration of children and young people. I'm Jessica Stewart. I'm the Executive Director of Family and Community Services, Insights Analysis and Research, also known as FACSIAR in the New South Wales Department of Communities and Justice. Before we begin, I would like to acknowledge that wherever we're joining today's webinar from across New South Wales or across the rest of Australia, we are living and working on Aboriginal land that was never ceded. I'd like to personally acknowledge the Bidjigal and Gadigal people, who are the owners and First Nations people of the area where I have the privilege of joining you from today. And I'd like to pay my respects to all First Nation elders past and present and extend that respect to our Aboriginal and Torres Strait Islander colleagues joining us today. I'd also like to really warmly welcome all of you, our webinar participants. We have had more than 1,000 people register for today's event. Many of you will watch today. Many will download after today's event, and it just really goes to show the value that you all place on research evidence in the work that you do, and what a fantastic place to come to today, given we are presenting 10 years of the Pathways of Care longitudinal study. POCLS, as it's colloquially known, is funded and managed by the New South Wales Department of Communities and Justice, and it's Australia's first large-scale prospective longitudinal study of children and young people in out-of-home care. It collects information on the safety, permanency and wellbeing of children and young people across key developmental domains, including physical health, socio-emotional wellbeing and cognitive learning ability. So in today's webinar, Marina Paxman, who is the project manager for POCLS, will present key findings from 10 years of POCLS research. We'll also hear from Dr Fred Wulczyn, Director for the Centre for State Child Welfare Data in the USA, who will outline new findings on restoration pathways, and Joanna Hopkins, Data Manager for POCLS, who will talk about trends over time and the factors associated with successful reunification. Following these presentations, we'll have a panel discussion on what these findings mean for policy and practice. And again, this session will be recorded and posted on the FACSIAR webpage, along with the slides and a bunch of other resources. So if you have registered for the webinar, you'll receive a link to the recording within a week. Now, we do have a lot to get through. I do also just want to personally acknowledge the long-standing commitment of our POCLS team. Those who you will hear from today have been involved right from the beginning, and I'm really want to just pay my gratitude to the commitment and passion the team has for building the evidence around children who experience care. And I will now pass over to Marina Paxman, who has been involved since its inception, is the project manager responsible for the study's governance, data collection, commissioning analysis to academic experts and knowledge translation. Marina's team works closely with the Human Research Ethics Committee, oversighting the study, the Aboriginal Governance Panel, and internal external stakeholders. And I'll just quickly, Marina, introduce the rest of our presenters before I hand to you. So Fred Wulczyn is a leading scholar known for advancing the integration of research evidence, administrative data, and systems science to inform policy and practice. As Director of the Centre for State Child Welfare Data and a Senior Research Fellow at the Chatham Hall Centre for Children, Fred has a keen interest in understanding how we care for children who are not living with their parents, and has spent more than 4.5 decades shaping how public systems understand and manage child welfare outcomes. Joanna Hopkins has been the data manager for POCLS for the last 5 years, overseeing quality assurance and providing support to researchers using the POCLS data asset. Jo's team also undertakes analysis and develops publications, including dashboards, statistical reports, and more in-depth research reports. Jo previously worked in DCJ operational performance, statistical analysis, and child protection reporting teams. We also have Carol Aliburton, who is a proud Wiradjuri woman with 26 years experience in DCJ. Welcome, Carol. Carol has worked across child protection, out-of-home care, the helpline, and Brighter Futures. Carol has held senior roles as Senior Project Officer in DCJ for Family Functional Therapy and MST CAN, Aboriginal Permanency Coordinator, and is currently seconded to the Aboriginal Culture in Practice team. Carol is deeply committed to strengthening outcomes for Aboriginal families with a strong passion for restoration and culturally informed practice. Thank you so much for coming today. And Beck Hinchley, who you may have seen present before, is the manager of the Restoration and Family Time team at the Department of Communities and Justice. The role oversees strategy, program development and policy for restoration, connection and family time for children in care. Beck has been with the department for more than 10 years in various roles and is passionate about all things social justice with a particular interest in children and refugees. Thanks so much for joining us again today. Thank you again so much. Welcome to all of you, and please go ahead, Marina.
Thanks, Jess. So I would like to also acknowledge the land of the Wongal people that I'm on today, and acknowledge and pay my respects to Aboriginal elders past, present. And I also want to acknowledge the stolen generations. And I would also like to acknowledge the children, young people and caregivers who participated in the interviews. So I'm just going to start with a few slides on the study design, and then I'll move into findings. So this diagram shows that the POCLS, how the POCLS sample was selected. So the population cohort is a census of all children and young people who entered care for the first time between May 2010 and October 2011, and that was 4,126 children. Every child who received final orders by April 2013 became the final orders cohort. And the research team rang every carer in the final orders cohort to tell them about the study and to seek their permission to pass their contact details to an independent data collection agency who were conducting the interviews. And a total of 1,789 children are in the final orders cohort, in the interview cohort, sorry. And in 2025, we did our first round of interviews with 18 to 25-year-olds. So the study design is to follow children regardless of their trajectory, including those who leave care through restoration, guardianship, adoption, and remain in long-term care until they turn 18. This allows the POCLS to collect data on the long-term outcomes and support needs of children who experience out-of-home care. So this table shows how many children have participated in the POCLS interviews over 6 waves at approximately 2-year intervals. The total number of interviews decreases over the waves, which is partly attrition and partly young people turning 18 years old. So at wave 6, we had a response rate of 74%. Approximately 40% of the children who have participated in the interviews have identified as Aboriginal. So by wave 6, 394 children had completed an interview at every wave, and 1,528 children had completed at least one interview in one wave. So at wave 6, the interviews with children under 18 were completed in 2024 and tracked the infant cohort transitioning to high school. And we completed 124 interviews with 18 to 25-year-olds for the first time. Wave 7 will commence later this year and will be the final wave of data collection for the POCLS, seeing the infant cohort to 15 to 17 years old. And we will conduct one more wave of interviews with 18 to 25-year-olds. So the POCLS collects data on children's health, socio-emotional wellbeing and cognitive learning ability, and undertakes analysis to find out what factors influence children's development. Children's developmental outcomes are measured using highly rated standardised measures widely used in research studies. Children in the clinical range, borderline range or at-risk range should receive professional, culturally appropriate assessments, support and ongoing monitoring. This slide shows the results of caregivers' reports of children's socio-emotional wellbeing measured by the Child Behaviour Checklist to assess behavioural and emotional problems. As you can see in the chart, over 6 waves of data collection, the POCLS has found that children in the study are less likely to be in the normal range for socio-emotional wellbeing over time. By wave 6, approximately 12 years after entering care, 37% of children scored in the clinical range for the total problem scale, and which is 2.5 times higher than that found in a sample in the general population. We also show the results for Aboriginal children, and the pattern is very similar. At every wave, children aged 3 to 17 years complete the Peabody Picture Vocabulary Test to measure verbal ability. The activity involves the interviewer saying a word to a child, and then the child has to point to the picture that illustrates that word. We found that children's verbal ability has remained relatively stable over time, and most children in the study are in the typical range. 12 years after entering care, 21% of children were below the normal range, which is higher than 15% found in the sample of the general population. And again, the results for Aboriginal children is similar. Every wave, children aged 6 to 16 complete the matrix reasoning test from the Wishler Intelligence Scale for Children to measure nonverbal cognitive ability. The interviewer shows the child an incomplete matrix, and the child selects the missing piece from 5 options. We found that children's nonverbal ability has remained stable over time, and most children in the study are in the typical range. So 12 years after entering out-of-home care, 25% of children were in the at-risk range, which is higher than the 15% found in a sample of the general population. Again, the results for Aboriginal children are similar. So the POCLS Commission's academic research is to undertake analysis on the factors influencing children's development to inform policy and practice and improve outcomes for children in care. Currently, we have 10 Aboriginal-led analysis projects underway, and they're due to be completed this year. In 2024, 10 commission papers were published in a special issue on the POCLS in the International Journal of Child Abuse and Neglect, and covers a range of topics including health and development, socio-emotional wellbeing, educational outcomes, children with disabilities, placement stability, restoration, and carer wellbeing. We will post the link in the chat to this special issue of the journal, and I'll just summarise a range of findings from these papers. So a paper led by Professor Raghu Lingam at the University of New South Wales examined factors associated with social-emotional wellbeing trajectories of children out of home care and identified 3 stable social-emotional trajectories among children in care: persistently low difficulties, normal range, and clinical range. The proportion of children in each trajectory group was 29%, 43%, and 28%, as shown in the figure on the chart. Children in the clinical range were more likely to be male, experienced 8 or more substantiated pre-care ROSH reports, have experienced emotional and sexual abuse, experienced multiple placement changes, and have carers with moderate to high psychological distress. Children with persistently low socio-emotional difficulties were more likely to be placed with relative kinship carers, have carers with low psychological distress, and have fewer than 8 substantiated ROSH reports. And a paper led by Professor Melissa O'Donnell from the University of South Australia on the health and developmental outcomes of children found that most children who enter care as infants had a high level of developmental vulnerability, and they predominantly remain in the out-of-home care system into their childhood. In the first 18 months of care, 36% of infants were at risk of developmental delay in physical health, and 70% were vulnerable in measures of health and social-emotional development. In the first 5 years of care, the proportion of children at risk of physical and cognitive developmental delay decreased from 65% to 36%, but the risk of socio-emotional development increased from 20% to 30%. This aligns with the previous slide I showed you on the declining socio-emotional wellbeing of children over time. The POCLS shows that the proportion of children receiving services for developmental needs increased substantially from 17% in the first 18 months of out-of-home care to 45% in the 5th year of out-of-home care. And a paper which was led by Dr. Miriam McLean at the University of South Australia on children's educational outcomes found almost half of the children scored in the high achieving range in the Year 3 NAPLAN reading assessment. Although this is lower than the general population, it shows that many children who experience out-of-home care are achieving well. The factors associated with high levels of reading achievement include younger aged children at entry to care, average or above average cognitive ability, low externalizing behaviours, and highly educated carers. And less than half of the carers of high achieving students said their child had an education plan, and less than a quarter had received tutoring. This paper found that positive reading trajectories were associated with early intervention, stable placements, and carers valuing education. Then a paper by Professor Rebecca Mitchell from Macquarie University on carer wellbeing and support found carer satisfaction with information they received about their child and their working relationship with agencies was linked to better socio-emotional development. High psychological distress amongst carers was associated with poorer child socio-emotional and verbal development. Carers satisfied with assistance from caseworkers reported fewer concerns about their caregiving and wellbeing. Carers who are employed and caring for multiple children were more likely to report concerns about their wellbeing. And relative kinship carers were generally more vulnerable than foster carers. The associated factors include older age, health issues, fewer resources, greater psychological distress, and they receive less support from caseworkers. Yet despite these challenges, children in relative kinship care showed slightly better developmental outcomes than those in foster care. So from all the POCLS analysis completed to date, including over 40 research publications, the POCLS has found that child wellbeing is positively associated with early culturally sensitive assessments, referral to professional services, and ongoing monitoring for socio-emotional wellbeing. Education pathways starting with high-quality childcare or preschool, early assessments, education plans, and ongoing interventions such as tutoring and monitoring. Family time with parents and siblings, including relationships for Aboriginal children grounded in connection to country, people, and culture. Effective casework engagement, ensuring tailored support for carers and supporting all children to have a voice in decisions affecting them. And around the time child protection issues are reported, parents' vulnerabilities should be identified and supported, including advocacy, clear communication, to ensure that parents understand the decisions being made, the legal process, and their rights. So I just want to share with you some results we've collected from the last wave of data collection from 251 young people aged 12 to 17 years who are in long-term out-of-home care. We're currently writing up these results and they'll be available towards the end of the year. So this slide is what children told us about their connection to culture. The vast majority of Aboriginal young people in out-of-home care said they feel they live with people who respected their Aboriginal culture. About 2/3 said they know people who can tell them things about their family and community. They are told stories about their culture, communities, and nations, and they feel connected to their culture. 18% said they know some language from their family groups or other Aboriginal languages. When asked about living arrangements, the majority of young people said they feel settled where they're living now, 86%, they feel safe, 91%, and they feel at home, 79%. Young people, we asked young people about the amount of family time they have with their birth family, and about 1/3 said they spend less time than they want with their family, both on the maternal and paternal side. About 2/3 said that they see their family as much as they want to or more than they want to. And then the POCLS includes questions about leaving care for young people 15 to 17 years old in foster care, relative kinship care, and residential care. The carers said they thought the 15 to 17-year-olds in their care will need support with independent living, particularly around the areas of finding somewhere to live, budgeting, accessing financial support or assistance with accessing their DCJ file, and help accessing services such as medical, legal, and counselling. The majority of 15 to 17-year-olds said they worry a little or not at all about turning 18 and their future. And about 2/3 of 17-year-olds said their caseworker had started talking to them about a plan about where they will work, study, and live. And only about 1/4 of 17-year-olds had a plan or information in writing. Caregivers were asked if they were willing to have the young person stay on living with them after they turned 18, and the vast majority of foster carers and relative kinship carers said they were happy for the child to stay on. However, we found that only around half of the young people thought they would stay living with their current carer when they left care at 18. And the last slide on their findings from the young people is about optimism for the future. 2/3 of young people were optimistic about their futures, and 67% indicated they thought things would go very well or fairly well for them. So in the last interview, we asked 12 to 17-year-olds this question: what are one or two things that an adult could do to help children and young people who are not able to live with their parents? So the themes that emerged from 93 responses from the young people were to maintain meaningful connection with family, actively listen, talk openly, allow children to participate in decisions, and provide emotional reassurance. Make sure children feel safe, loved, made to feel at home. Provide practical support for essential needs, and support parents and restoration. So the POCLS has produced an extensive database with over 5,000 interviews conducted over a 12-year period, and that's matched to record linkage data to child protection, health, education, and offending. We've worked with academics and researchers, practitioners to produce over 40 research reports, journal articles, and evidence to action notes on a range of topics. We'll be working with the out-of-home care reform team to answer their priority policy questions. And we will be conducting the last wave of interviews starting at towards the end of this year. So I will hand over to Fred. Thanks, Fred.
Thanks, Marina. Good afternoon, everyone. Before turning to the restoration findings, I want to first acknowledge the extraordinary contribution that FACSIAR has made with the Pathways of Care longitudinal study and what it means to our understanding of children and families involved with child protection systems across New South Wales. Around the world, there are surprisingly few studies with the scope, duration, and rigor of child protection, of POCLS. And as you undoubtedly know, we often evaluate child protection systems in terms of safety and well-being or permanency, but far fewer studies have sustained a commitment to understanding the broader question of child well-being over the life course, which of course is exactly what POCLS has done. It reflects a long-term commitment by DCJ to build knowledge that informs policy and practice, and it's a credit to the organization that it has stayed with POCLS over those many years. I especially want to thank Albert Zoe. Our work together goes back more than 2 decades to a time when we built the first longitudinal data file from the FACSIAR administrative data. And I also want to express my gratitude to Marina Paxman and the entire POCLS team. It's been a pleasure, and I am grateful for the opportunity to collaborate. The work I'm presenting today builds directly on that collaboration. As in the case with other child protection issues, the question I want to focus on, restoration, is a deceptively simple one. What does it take for children in out-of-home care to return safely to their families? At one level, this is a simple question about restoration. At a deeper level, it is a question about the role of families in society. As a general rule, societies have delegated responsibility for raising children to families. Child protection systems exist because there are times when families are not able to provide children with the safety and care they need. When that happens, the state intervenes. But intervention has never been the preferred route. Across societies, the expectation remains that families occupy a central place in children's lives. You heard from the words of young people themselves about the importance of family and culture to them. And that central role is what restoration acknowledges. It reflects a commitment to 2 fundamental responsibilities: protecting children from harm and preserving the role of families in raising children when they can accomplish that safely. Viewed from that perspective, restoration is more than an administrative or permanency measure. It's a critical transition point. It marks a change in responsibility, a change in relationships, and a change in the way the system engages with children and families. Understanding how, when, and under what circumstances that transition occurs is therefore central to understanding how the child protection system functions. These insights are what has motivated this study. What does it take for children in out-of-home care to return safely to their families? Restoration, or reunification it is called, as it is referred to in the US, is often viewed as the desired outcome of child welfare services, but restoration is not a binary event, yes or no. It's a process, it unfolds over time, and the opportunities for restoration change as children move through the system. So you've heard about the sample for the POCLS study. In this particular case, we're using the administrative records from not just the POCLS cohort, but additional cohorts that happened later. Their entries into care occurred later, and we're going to be following their time in care. So the study objectives here are to identify when does restoration occur, not simply does it occur, the factors that influence restoration over time and whether those factors themselves are changing, and what does all of this imply for improving transitions from care. Very quickly on the data and methods, and I encourage you to look at the slides themselves so that we're not taking all of the time here that we have on these matters. But the additional cohorts, in addition to the POCLS cohort, are admission cohorts from 2018 to 2023. And we follow those children until they are restored, until they exit for some other reason, or the end of observation occurred, which was December of 2023. And to understand the process itself, how does it change over time? We measured time in 6 months intervals to match service dynamics. This is referred to as discrete time survival analysis. Again, I encourage you to read look at the slides themselves to get a better understanding of what that exactly means. But the idea, again, is not to treat restoration as a simple binary, did it happen or did it not happen, but to look at how the likelihood of restoration changes with time. And as you'll see, that's one of the most important findings. So what are the general findings? POCLS cohort, the 4,126 children that were observed through administrative data, 31% restored, 12% to guardianship, and 2.5% to adoption. The remainder are still in care. So restoration is, as I said, relatively uncommon. And then when we look at later cohorts, 2018 to 2023, restoration is declining, although some of that is attributable to the decline, the shortened observation window. For the POCLS cohort, we had quite a bit of time to follow what was going on. But at the end of the day, the summary conclusion is that restoration is in fact relatively rare if we compare it to trends in the United States. The likelihood of restoration by age is as high as 60% for young people in their teens. This is probably the most important graph, and I'll show you variations of it. It illustrates what we mean when we say the process of restoration is time dependent. It's time varying. The orange line that you see is restoration, and it declines very quickly. About 12% of the young people who enter care will be restored within 6 months. But thereafter, there's a rapidly declining probability that young people will be restored. Once you get out after 4 years, the probability of restoration is not zero, but the probability is quite low. And the other lines indicate, and the blue line are guardianships, and that bump in the guardianship data is likely the the change in policy as it reflects guardianship. You'll see that guardianships are more common later on in the young person's experience in out-of-home care, but that adoption and restoration are quite low once you get past 4 years. This is a comparison of trends over time. The 2018, 19, 20, and 21 cohorts. Again, these are shorter observation periods. As you can see, if you look at the x-axis, that's the number of intervals of time we were able to follow the young people. But you can see that there's a very characteristic pattern. Early reunification. In the 2018 group, there was a slight increase in the probability of restoration. That is a persistent finding. If you follow the contours of the blue line, you'll see that it is high, it declines, and then there is a rise in the probability of restoration that eventually falls again to 0. The pattern is most noticeable in the 2018 group. But again, the important thing here is the persistence of this pattern, that young people early on are likely to be restored within the first year, 18 months, but thereafter the probability declines significantly. What are the common factors that go in? We've already talked about time in care, the decline in restoration probabilities decline with time, and especially for younger children who are more likely to spend a significant portion of their childhood in out-of-home care. We've also observed in the data placement type matters, kin versus non-kin primarily, the case management provider, DCJ versus NGOs, where in New South Wales the placement takes place, the number of placements, and a persistent finding throughout the number of ROSH reports before entry into out-of-home care. Marina talked a little bit about the relationship between ROSH reports and developmental well-being. Placement type, kinship care, is consistently lower than foster care, perhaps because when living with kin, the priorities over restoration are rebalanced. Case management provider, NGOs, have consistently lower restoration rates than children whose cases are managed by DCJ. Aboriginal children are lower, have a lower likelihood of restoration across age groups, and disability, the presence of disabilities also affects, excuse me, the prospects of restoration. More placements, lower restoration, more ROSH reports, lower restoration. So what is the system doing over time? We talked about the early window, high restoration probability, the rapid decline, long stays, the transition shifts to non-restoration exits, and then what we might call system factors, placement provider, and the district, where in the state of New South Wales is placement being managed. And then implications for policy and research. The restoration work starts immediately at entry. I think this has something to do with prognosis. What are the prospects that a young person will be restored? That work begins initially, decisions are made, and then the probability of restoration goes down. Investments in restoration teams, family time, services access are likely important. And then monitoring provider placement and district, looking at the variation between providers is important to find out if there are providers who do relatively well versus others. What is it about the districts where restoration is less likely? Unpacking those factors and understanding how practice and policy might make a difference. And then tailoring support for Aboriginal children. We've already heard about the connection to culture and family and what can be done there. Disability, and then older youth who are less likely to be restored. And then the final takeaway really is about this issue of the rapid decline in restoration. What is it about the family dynamics and understanding how families where restoration is possible early on, the differences between those families and families where restoration takes place later versus adoption and guardianship, and understanding the presenting circumstances for families with those where the timing of the restoration varies. And then what about the children who are in the custody of DCJ for long periods of their childhood? What can be done to find families outside the care and custody of the public agency is another line of research that I think is important. And just further understanding of the underlying dynamics related to those early restorations, I think is extremely important. So with that, let me turn it over to Joanna for her presentation. And thank you again for your time.
Thanks, Fred. That's great. So as mentioned, my name's Joanna Hopkins and I'm the data manager for the POCLS. So today I'm going to be taking you through some findings from a recent statistical report based on interviews with parents after their children have been restored. So this report shows information collected from the parents about their experience before their child was removed, while their child was in care, and then after they were restored. So just as a reminder, the children in the POCLS cohort all entered care for the first time between May 2010 and October 2011. And the POCLS follows the child whether they remain in care, exit to restoration, or guardianship or adoption. So for children who are restored, it's their parents who are invited to participate in an interview. So this analysis focuses on the 153 children in the POCLS who've been restored and their parents agreed to participate in an interview. The analysis also includes some background information from DCJ administrative data sets. Okay, so first having a look at what we know about the parents from the DCJ administrative data. So the chart on the left shows the parents' age when their first child was born. So we can see that the mothers were often relatively young, and for around half the children, her mother had the first child as a teenager. Looking on the right, we show the parents' own child protection history. So 28% of the mothers had been reported to child protection themselves as a child, and 7% had been in out-of-home care. So the figures for the fathers were slightly lower. The fathers of 20% of children had been reported and 5% had been in care. So looking at the issues with the child protection reports made about the parents when they were children. So 20% of the mothers had been the subject of a report of sexual abuse, 17% had been reported for neglect, 16% for carer issues, and 16% for physical abuse. And for the fathers, 12% had been reported for carer issues and 12% for neglect. So the interviews were conducted with 92 individual parents about the 153 children. So around 40% of parents had multiple children in the POCLS. So 60% had one child, 26% have two children, 5% three children, and 9% had four children or more. And this table shows the characteristics of the parents that participated in the interview. So I just wanted to show you there that the majority of the parents that participated were mothers, so 85%. So the mothers' views are probably better represented than fathers' views. And that 20% of the parents identified as Aboriginal, less than 5 as cold. So it's not shown here, but 45% of the children were living with their mother only at the time of the interview. 8% were living with their father only. 29% were living with both parents at the time of the interview, and the remainder were living with one parent and a step-parent or parent's partner. So just of the characteristics of the household as reported by the parents. So 82% were renting or paying board, and most of the children were living in a household income with less than $60,000 per year. So parents were asked if they thought it was likely that their child would be removed from their care. So you can see from the chart on the left that 77% of children, for 77% of children, their parents thought it was unlikely or not at all likely they would be removed. And the parents of over a third said they did not understand the information they were given about why their child was being removed. The reasons parents gave for not understanding the information was that they were too upset, stressed, or the words that were used. So parents were asked to describe the reasons they were told for their children being placed in care. And this slide shows some of the themes that came out from the parents' responses and some direct quotes. Some examples are, I was told that me and my partner were not protecting the girls, the violence between my partner and I, the police were called out a lot, my drinking and my partner's drinking. So this chart shows the services and supports that parents said they received before the child's removal, which is shown in blue, and then also while the child was in care, which is shown in orange. So you can see that the use of professional services was relatively low prior to the child's removal, but higher once they were in care. So for example, 15% received counselling prior to the child's removal, but 62% received counselling while they were in care. And in terms of who found the services for the parents of 37% of children said they found the services themselves, while for 1/4, the caseworker was the main person who helped them find the services they needed. Parents were asked what more could be done to prevent their child from being removed. And again, the themes and some direct quotes are shown below. So the themes that generally came out were around clearer communication, providing more support or information about services, listening to their story, or some said that there was nothing else that DCJ could have done, saying things like, they could not have helped at the time, but it was the wake-up call that I needed. So parents were asked about the type of contact or family time that they had with their child in the first few months after the child's entry into care. So 91% reported that they had face-to-face contact in the first few months, and 9% had overnight stays. And then they're also asked about the contact they had in the month before the child was restored, and that's shown on the right. So almost 60% had overnight stays and almost 2/3 had face-to-face contact. 86% had family time at least weekly in the month before their restoration, and nearly half had family time several times per week. Parents were asked whether they found the main family time worker helpful at contact visits and whether they thought the child's carer was supportive of family time. So for 44% of children, their parents found the family time worker was helpful all of the time, and 1/3 found them helpful some of the time. The parents of half the children said the child's carer was supportive all of the time, and 22% half the time. So the most common places for family time to occur in the month before restoration was at the parent's home or in a public place like a playground, shopping centre or McDonald's. And these were also the same preferred places that the parents said that they liked family time to occur. The parents of around 60% of children reported that they received the amount of support that they always wanted, or most of the time, that they always wanted or most of the time. However, 1/4 didn't get the support they wanted, or they said they didn't have a caseworker. So looking at the improvement in family life since their child's removal and restoration, parents were asked, overall, do you feel you and your child are better off now than before they were removed? For almost 60%, their parents stated they were a lot better off, and for 88%, the parents believed they were at least somewhat better off. So in summary, I've got a lot of detail there, but in summary, many of the parents, and particularly the mothers, were young, and over 1/4 had been in contact with child protection themselves as a child. A large proportion didn't understand the seriousness of the situation and may not have understood the legal proceedings. The use of professional services was relatively low prior to the child's removal, but higher once they're in care. Not all parents felt comfortable and supported at family time, and the location was important to them. Some parents did not feel that they received the caseworker support they needed, but most parents reported that they and their child were better off now than before the child was removed. So we have some POCLS contact information there. So you can look on our website, and we've got all the publications are up there. And then I'll hand back over to Jess for the panel discussion.
Thank you so much, Jo, and thank you to Marina and Fred for really important presentations and a lot of valuable insights and evidence across the 3 presentations. And Carol, thank you again for joining us today. What are your reflections on the research presented today, and when working with Aboriginal families, what works well in the restoration space?
Thank you. Yeah, I'd just like to acknowledge that we're also meeting on country as well, and pay my respects to elders past, present and emerging. I think it's really exciting research that you've got, but I think from my perspective, when in the restoration space, from a practice lens, really embedding those elements in our practice of that partnership, prevention, participation, really bringing that and embedding that into our practice and our Section 9A active efforts. I guess probably for me in this space, like, and you know, you're sitting on our safeguarding decision-making panels as well, is that sometimes when we sit in when caseworkers sit in a place of when a child enters into care, sometimes that mind shift is so incredibly important to make us move over to what needs now to happen to restoration, for restoration to take place. And what kind of, what does that child's safe journey look like going home? Building trust with family and those connections is so incredibly important. Sitting alongside and walking alongside our families, understanding that they're also in a grieving process and maybe not be ready for that change at that point in time. There's so many challenges and barriers that, you know, casework teams face in that restoration space, like the timeframes for court, which can impact, you know, how restoration, you know, really kind of progresses. But I think also about that sharing of information, bringing people along on that journey, including carers, parents, and their support networks in that space. Yeah, so I think also around, you know, the tools, caseworkers using their tools that we have available for them, the family action plan for change. I think sometimes in my experience, families can become very overwhelmed with the summary proposed plans that, you know, are formulated for that restoration process. Really breaking that down with the families, including their support networks, allowing participation, uplifting Aboriginal voices and community. And probably one thing I would really, really highlight is Aboriginal consultation. That is so incredibly important, and it helps us guide our practice in a culturally safe way with our families. Embedding, like, you know, and unpacking our bias and what that looks like in that restoration process, and taking that family along on our journey with us in that restoration assessment, including them in that restoration assessment, not doing it before we get to them. So they're active participants in understanding, you know, what's working well, what's not working well, and holding space for them when things go off track is going to be really important, and sitting alongside them to say, okay, well, you know, this is what we sit with and it's okay. And wrapping around those support services in terms of how we can get them on track and how we can actually ground them back into, you know, that restoration process. Sometimes our timeframes don't necessarily align with the journey of healing that needs to take place with our families. So that's always challenging. Yeah. Beck, did you have anything that you wanted to add?
Sure. I thought I might talk a little bit to family time. I think that's something that Joanne really highlighted in her research. We know how important it is in assessment, but I think more importantly, it's such an important time of relationship rebuilding and healing, and a sense for children to really understand where they've come from. So it's really critical in restoration, but that connection that caseworkers, and I know it's often specialist workers as well, help children and parents build and their families build during family time. That's important whether or not a child goes home. So just really wanted to say no matter where you are, supporting that important relationship. And so I guess some of those really practical things are about explaining to parents at the beginning, what does family time, like what's supposed to happen? Parents are so overwhelmed. So just being really clear and not just explaining once, but multiple times, letting parents know, it's okay for them to be a parent. I think lots of parents, there's so many emotions during that time. They're anxious, they're so hopeful, but they're really worried about doing the wrong thing. So just being really gentle and kind in those explanations and understanding of what it is that they're going through. We've got some really great new resources. We've worked with a great parent group to develop some resources, so we'll get them. They've only just been published a couple of days ago, so we'll get them put on the Lunch and Learn website, and they're really about helping explain to parents about what family time is. I guess really just helping parents overcome those practical barriers sometimes. Like, sometimes parents are late and we can think, oh, they're not really committed, but maybe they've had to catch 4 buses to get here. And they've really, they've tried to juggling that with work. So really understanding those practical barriers and helping parents be able to overcome some of those practical barriers. I know, again, a lot of this work is sometimes outsourced. We call them to family time workers or to contact workers. But I think it's really important that if you're working in the restoration space, that you attend and support some of that time yourself. It's such a critical part of the assessment. And a critical time to support what parents are already learning. So you need to go along yourself sometimes as part of that work. And helping yourself or either working with the family time worker to really give some of that really specific praise and really that strengths-based praise. Let parents know, what it is that they're doing well and how their child's reacting to them. When you did this or when you bent down and played with little Johnny, did you see his eyes light up? He really responded to that. So that really practical hands-on support. I think really working quite specifically with the family time worker, it's not just a matter of seeing their reports or giving them the referral, but, having that quick conversation in the office or on the phone. We've been, mum's been learning this at a parenting course. Can you please help or watch out or give her support with that? Let me know how it's going. Just a quick conversation, 2 or 3 minutes, or involving them, when you're doing your assessments. What did you think? How is it going? How are you supporting them? The other thing I think you mentioned, Carol, briefly, but just is really supporting that relationship with carers. Carers have a really, really critical role. We know the research about how important they are in children going home and that positive relationship. And it can be tough for carers as well, right? We need to have that empathy for everyone, for the child, for the parent, for the carer. So that, things that you can do to help maintain that positive relationship, and that it's really child-centered for everyone, letting the carer know what information they can share, helping the carer to help the parent to be involved in the child's routines, especially as that restoration journey is coming closer to home. We really need parents to be part of the everyday lives of kids, homework, school, taking them to doctor's appointments. Those are the sorts of things that as the restoration journey continues, that parents really need to be involved in, and we can support parents and carers to do that. And I think also recognising that for some carers, particularly when it's been family, like there can be a lot of heightened emotion. There's a whole lifetime of relationships there. And so that can be really about supporting those relationships to heal, and supporting, you know, grandparents, aunts and uncles, knowing what it is they can do, because lots of times they're like, oh, can I let mum into the house? When can I do that? So really talking to them about that, and really recognising that there's going to be extra emotions there that either, you know, you can support yourself or you might need a specialist service. So probably getting close to time now, Jess, so I might hand back to you.
Thanks, Beck, and thank you so much, Carol. Some really great practical examples of what you can do to support the restoration process. We are almost out of time, and I think you've just spoken, Carol and Beck, to a number of the questions and comments around restoration practice and what works to try and either work with families before a child is removed or help with restoration. There is one comment in here that I just wanted to read to you, and anyone of our presenters, please comment. And it is really relating to, Fred, your findings around seeing those restoration rates really drop off after that first 12 months. One of the comments says, sitting in the SIFDU space, we have some parents coming back to us, having had their children in care for a long time, asking to commence a Section 90 restoration, and the conversations need to start with the care agency around this, and that can be quite difficult. And I'm keen for people's views around how to best support that process once a child has been in care for some time. Fred or Beck, any
I'm
comments
happy
from
to
you?
talk to that, and maybe Carol a little bit as well.
Carol, yeah.
We know in New South Wales, we've got specific legislation that looks at, I guess the key test is, has there been change in relevant circumstances? We know that it's the child's voice that is really one of the key considerations for the court, but also their length of time in care, and the stability of those care arrangements. So I guess those are some of the important issues that the court will look at, or that will need to demonstrate to the court if a child is going to go back home to mum or mum and dad, or dad, as it might be. And so I think it's about gently exploring those issues as we start off. And that might be looking at what some of the evidence is around parental change, looking at why the child was first came into care, looking at the child's sense of belonging. So has the child, you know, been changing placements a number of times? I think that's a key reason why we should, you know, when there's any placement, I don't really like that word, but placement instability, that's a real key time when we should be looking at restoration. What's the child telling you? Has the child been asking you consistently that I really want to go home to mum? Mum's got a new baby. She's able to look after the baby. Why can't I be going home? And I think, you know, that's another time. If you're in New South Wales, and, you know, that might be a time, and you're a caseworker, might be a time to talk to your permanency coordinator about, you know, is this the time? What is it? What evidence do I need? And again, maybe talking to your legal practitioner around what evidence will the court need? Is there enough here? And then having those conversations with everyone, being really open and transparent with carers, with children, and with parents. We know sometimes parents will have made incredible change, but there might be a really strong relationship with the child and the carer, and the court will look to that relationship despite the incredible change that parents have made. But I do think that particularly for Aboriginal families, and I know some of our Aboriginal legal team, Wurrugamara, has been looking at this a lot more, about bringing in those Aboriginal child placement principles around what's the child's connection to culture, and how do we use that in helping bring evidence to the court about why this is in the best interest of the child.
And I think back, just adding to that as well, when we're doing our annual case plan reviews with children in out-of-home care, best practice also tells us we need to be parallel planning in those stages as well. It's not just long-term court orders have been made to 18. When we do those, the 12-monthly case plan goals, part of our role in parallel planning in that permanency aspect is also about, exploring what are the parents doing. So it's not such a big shock if, say, the parents come to a SIFDU to say, I want to apply for a Section 90. We're continuously monitoring that connection, and that children need to have, the Aboriginal children in particular, need to have that connection to family and kin and country all throughout this time. It's not just like a one-off, but, if we're continually actively looking at that pathway of restoration, regardless if long-term orders have been made, that's a great time to actually do it in our casework as well. And you can also parallel plan with the families if they're saying, I'd really like to have my child back if the child's been in care for a couple of years, doing a family action plan and that parallel planning to say, okay, well, these are the goals we'd like you to meet in this point in time. How can we actually, use our active efforts in supporting you get there? So, it's a gradual process of what we're seeing with the parents, achieving those goals for that safe journey home. But also, like, one thing that can also be very incredibly important is that therapeutic space for the carer and the parents if restoration is going to be done, because when carers are on board, we have a higher success rate of that restoration process. And there's a lot of feelings and, uncertainty that the carers may have in that space too around, that restoration process and whether they're on board with it too.
Thank you so much. Well, I think we're at time. If I can just steal one more minute of everyone's time, and I'll just go around to our presenters and say if there's one key message you would like our participants to take away from today. And can I start with you, Beck?
Sure. Sort of cheating a little bit with two, but keep the child's voice central and stay engaged through setbacks.
Thank you. Marina?
Well, I think for caseworkers to build a relationship with children and meet with them one-on-one so they feel comfortable to ask questions, make sure that they're safe.
Thank you. Jo?
Well, the thing that really stood out for me was just the young age of so many of the mothers, and, that they had, so many had their first child when they were a teenager and had been involved in child protection. So they really faced a lot of challenges when they had that baby.
Thank you. Carol?
Just really embedding those 5 key elements of partnership, prevention, connection, placement and preservation into our practice, really walking alongside our Aboriginal families, holding space and understanding the power that we do sit with our families, and creating that culturally safe environment for them to actually, meet those goals.
Thank you. And Fred?
Well, I think the restoration, adoption, and guardianship, but then there's also the question of long-term out-of-home care and what exactly is the meaning of that. Its relationship to parental rights, the rights of the child, and examining the idea that there are, in fact, quite a few kids who spend the majority of their childhood in public care. And what does that mean to the definition of family and all of the issues that I raised at the outset?
Thank you so much. Thank you to everybody who has come along today and spent time listening to these wonderful presentations and discussion. Thank you again to our presenters. And can I encourage you all to come along to our next month's webinar on the 16th of July at midday again around early childhood development and disability support. And we will share the slides and the presentation on our website along with a lot of resources around restoration particularly, and we'll try and answer some of those questions in the chat as well. But for now, have a wonderful rest of your day, and thank you again.
Bye-bye.